I enjoyed when you opened this and that you showed the clitoris. So, talking about like vaginal anatomy, you know, the tip of the clitoris is just like the tip of the iceberg, right?
Kind of surprising, huh?
Surprise! I saw a little surprise going on
Some people
behind
don't know
that.
that.
So what about that you explain to me like anatomy 101, back to like school, and what's what does it do, and let's open the layers a little bit so I can better understand my body.
Sure. So what most people refer to as the clitoris is actually just a little tip, this little head of the clitoris. And most of the time it's hidden by a little
Hood.
membrane, a little piece of skin that we call the hood. So to see the actual clitoris, you have to lift up this little piece of skin. So the skin itself is not the clitoris, it's hidden underneath. Right under what we refer to as the clitoris, we'll show you a little bit later on, there's another opening, a tiny opening, that's the urethra. So it's the opening of the bladder where you store your pee. The urethra is the tube that connects it to the outside. So that is right underneath the clitoris. The vaginal opening is actually quite a bit lower, so not at all the same thing. And right in the back, then you have your anus where you poop. So so if we continue on the outside, we have the small labia. They can be extremely small, they can be almost invisible, or they can be very large, elephant ears, everything is absolutely normal. The bigger labia, that's where the hairy skin is where you have more fatty tissue, more plump tissue. That's the larger labia on the outside. When you go on the inside, that's where Madeleine had a surprise. It's to find out that the clitoris is not just this little nub that we see on the outside. It's actually a pretty big organ. And actually, if you think of human anatomy, this would be the equivalent of the penis shaft in a man. So that's why it's quite large, and it goes around the vaginal opening. That's why sometimes the stretching sensation can be quite pleasurable. So it's not just the outside touch. The internal sensations can actually be pleasurable. And as Karine was mentioning, when you do the O shot, it's an internal injection as well. So you go and simulate this part, the underneath part of the clitoris, and both of the arms.
Cool.
And by saying that, the anatomy, like this here is just a model, so everything is kind of, again, like very plump, very symmetrical, and all uniform in color. But like anatomy is, as much as me and you are different on the outside, the vulva is different also.
Yeah.
So it can, the vulva, like the small lips or the labia minora, can be asymmetrical, larger, smaller, or almost non-existent.
Yeah. Different colors.
The clitoris can be
textures.
larger. The hood can be larger. It could be very, very, like very, very small.
Yeah.
Every vulva is different and normal.
Yes, there's not a whole lot that we would consider abnormal on a vulva.
Yeah. So I'll be someone asking question. So that's your minora?
Yes.
Small labia.
Small labia. And that's a majority.
Yeah.
And how to find the clitoris? You go with the labia minora, and wherever it meets up, that's the clitoris.
Okay.
So if you have a confusion.
So when you were talking about it, this is smaller. Is it possible that that's kind of bigger, sticking out, different, like?
They're gonna be thinner for sure because they don't have fat in them, so they're not as plump, but absolutely they can be longer. So yes, they can absolutely stick out on one side, on both sides, or not stick out at all.
Okay. What's your role? What's the goal? Like, why do we have those? Why do we have two sets of like this?
It's mostly a protection role. So these are like little doors to keep the moisture in and the good bacteria in, and keep the bad bacteria out.
Okay. So I was talking
Same as the hair on the labia majora.
Hair is important? It has a role.
Shouldn't say it at Sparkle where we do laser hair removal on those.
What?
But technically, hair is a good thing. It actually protects the vulva.
Interesting.
Yeah. So okay, so I was talking about like the aging process, you know, and weight gain, weight loss. And then you mentioned clearly like the protecting mechanism of that. So is it normal if I feel like it's depleted a little bit? Like it's not, maybe I don't have the cushion I used to have. Like I feel like it's a little drier.
That's mostly on the outside part that you would be talking about. So if your outside part is depleted or it's not as big as it used to be, not as plump as it used to be, could it be because of weight loss? Could it be because of aging and loss of collagen? Then yes, absolutely, it can expose the internal parts and it can lead to discomfort, rubbing, dryness, irritation. Absolutely.
And here at Sparkle, we can do a wing lift, which basically is a little bit of PRP mixed with filler to kind of plump back the labia majora.
Does that hurt?
On Madeleine, yes.
I'm a wimp. I just like to complain.
But was it worth it?
Yes, it was.
Did you die?
No, I did not die. I did not die.
And it was
But
worth
it
it.
was worth it. Because yes, it does help for dryness.
Yeah.
Do you know what I mean?
Yeah.
Yeah. Help a lot.
Okay, so instead of trying to, you know, trim down the small labia and hide those, instead you just plump up and get back to your normal architecture on the outside to put everything back in its place.
And to your question, does it hurt? Well, we do numb a little bit of the area because of the needle that goes in to inject, but you might still feel that little prick.
Yeah.
Prick?
Okay, for me, it hurt right there.
Oh, the périnée.
Le périnée.
Yeah.
Because we go like right here and right there when we go, and then it goes up. And I guess, but yeah, it's that entrance of the needle.
That would be discomfort.
A little bit of discomfort.
But is it dangerous? Like what's in here? Can we harm anything?
It's just a little bit of that fatty tissue that's kind of there, so there's nothing necessarily to harm. It is just when we puncture the skin that you feel. Other than that, with the cannula, you don't necessarily feel it because there's not much sensation upwards, but like inside. But when you go through the skin.
Okay, so a little bit of pain, maybe some bruising, but other than that. Yeah, so the answer to is it a one and done is no. The answer is probably you will need a top up and probably you will need another injection next year if you want to maintain your results. Did I get that right?
Yeah.
It's like dermal filler. Try it once, you don't want it, you can have it more, and then once you're happy with it, you just
You maintain.
You maintain.
Yes.
Sounds good.